Family group conferences are meetings held for vulnerable children or adults. They're attended by members of the family, birth family, friends, the community, networks that are important to the children or the vulnerable adult. They hear concerns from the local authority and they're given the opportunity to come together to make a plan that keeps safe and meets the best interest of the child.
Family group conferencing has been in the UK since the 1990s, and Harrow Local Authority have been really interested in making sure that this process is embedded. That means in the last 3 years we've been providing about 180 allocations in that time, and we're trying to do that as part of normal everyday social care business. So what I mean by that is that when a family comes in through a referral through the front door, we are trying to support them so that if they then leave as early supports, they might have had a family group conference, but we're going right the way through to those that might need more intervention, like child in need or child protection, and indeed the more complicated issues of when you need to go to public law outline that precedes court intervention at proceedings level. And we're really interested in making sure that families get the chance, as well as their children, to influence what should happen next and how that should happen.
Family group conferences are a really positive way of working with families, and there's been a lot of excitement about them. They've been around for a while, but I think there's a lot of excitement across the UK, created by various places that have been using them with apparent success. So Leeds is one of the standard bearers. Glasgow has also been experiencing a lot of success with family group conferences. And as a result, lots of other local authorities are looking to roll out and use family group conferences to help involve parents, children and family members in key decision making about their lives. We recently completed a review of all the evidence about the effectiveness of family group conferences. So that looks, and other ways of involving families. So that looks at all the evidence from around the world and tries to sort of bring it all together. And to summarise a complicated picture, there's lots of studies, but the picture of the effectiveness of them is that it varies a lot. So there are certainly studies which show family group conferences achieve a lot compared to service as usual, but there are also ones which show no difference compared to service as usual, and there are even some that show unexpected results. For instance, there was a study published last year which showed children who had family group conferences were a bit more likely to go into care than those that didn't. So it seems important for us to get a handle on what difference family group conferences make. And to do that, you need a study that has a really good comparison group, because we certainly know that people like family group conferences and appreciate them, but a complexity in the evidence is that often people seem to like the other services they get, and therefore it's really encouraging that Coram for the What Works Centre are undertaking this piece of research where they will compare two fairly large groups of families. One got family group conferences and the other get the normal service, to see the difference that family group conferences make. And hopefully that will produce evidence that will help inform local authorities and practitioners, and perhaps most importantly parents and children themselves, about whether they want to be using family group conferences.
Coram has been delivering services to children for a considerable number of years. What Works is really important to us. We're delighted to be working with 24 local authorities to carry out a randomised controlled trial of family group conferencing. What we want to point out is that these local authorities do not offer family group conferencing at pre-proceeding stage at the moment, so families will not be denied what they may already get. We also want to point out that the voice of families, the voice of children and the professionals they work with is really important to us. So although the randomised controlled trial is quantitative in its focus, we will also be carrying out a qualitative part of our study which will capture the thoughts and feelings and views of people.
This will be the first randomised controlled trial of family group conferencing in the UK. Randomised control trials, RCTs, are special because, unlike other kinds of methods, they can allow us to establish cause and effect. Well-planned and executed RCTs can allow us to show that family group conferences, rather than other factors, explain benefits for families. That's because they involve randomly assigning families to be referred for a particular approach or service or programme. So the only difference between families is whether or not they're referred or not. It averages out the other differences. And that's important in the context of family group conferencing because families' lives are so complex. It allows us to cut through all that complexity, all that noise, and hear the signal being sent by the family group conference. And so when we look at the outcomes of the different groups of families down the line, we're able to attribute any differences we see to the fact of being referred or not for a family group conference.